Many boys with severe hemophilia are diagnosed within the newborn period related to bleeding with circumcision, heel stick, venipuncture, or immunizations. Any bleeding events in infants should prompt investigation for a bleeding disorder, even in the absence of a positive family history. In this case, we have the patient diagnosed early because of bleeding after circumcision, and we're faced now with the question of how to move forward. The current standard of care treatment for boys with severe hemophilia is primary prophylaxis. We now have a strong evidence base to support the short and long-term benefits of prophylaxis and rationale to initiate at a young age and prior to the onset of joint bleeding. Shared decision-making is an important aspect of hemophilia care, especially when considering prophylaxis. Overall, the goal of shared decision-making related to prophylaxis should be to identify the treatment strategy that will work best for the individual patient and family. The route of administration and dosing frequency of a treatment product may impact decision-making. Options for prophylaxis now including clotting factor replacement, including standard half-life and extended half-life products, which are administered intravenously 2 to 4 times per week, and emicizumab, which is administered subcutaneously 1 to 4 times per month. Despite the ease of subcutaneous injection, some families may prefer clotting factor treatment given the long track record and large amount of data from clinical trials and real-world experience. Available data for various treatment options should be reviewed, as well as the gaps in knowledge. Current gaps in knowledge include inhibitor rates in previously untreated patients treated with extended half-life clotting factor. Also, although emicizumab is approved for all ages, clinical trials have not included previously untreated patients, and there are limited data in children less than 6 months of age. We have no data on inhibitor rates in previously untreated patients who start emicizumab prophylaxis and use factor VIII as needed for bleeding.